Hello and welcome to Health Dialogue Show. I am Dr. Bhumika, and every year on September 29th, the world comes together to raise awareness about cardiovascular health. But this year, the message feels more urgent than ever. We're witnessing a worrying shift. More and more young Indians, especially those in their 30s, are falling victim to heart blockages and sudden cardiac events. Once considered a disease of older age, heart conditions are now striking far earlier and often without warning. In today's conversation, we are diving deep into the real reasons behind this alarming trend, and we'll be sharing expert backed tips to help young adults take control of their heart health before it's too late. Our expert for today is Dr. Jatin Yadav. Sir is an experienced and highly skilled cardiothoracic and vascular surgeon, currently the head of the Cardiothoracic Vascular Surgery Department at Manipal Hospitals, Gurugram. With over a decade of clinical experience in cardiac surgery and a strong foundation in advanced surgical techniques, Dr. Yadav is widely recognized for his precision, dedication, and compassionate patient care in the field of heart and vascular health. Dr. Yadav completed his MBBS from PGIMS Rohtak and went on to pursue his DNB in cardiothoracic and vascular surgery from the prestigious Fortis Escorts Heart Institute in New Delhi. He specializes in a wide range of surgeries including off-pump coronary artery bypass grafting, heart wall repair and replacement, aortic surgeries, and peripheral vascular procedures. He is also proficient in minimally invasive cardiac surgeries. Dr. Yadav's commitment to excellence is evident through his active participation in research with several published articles and book chapters on cardiovascular care. He has contributed to the development of techniques in hybrid myocardial revascularization and the surgical management of hypertension related complications. So please join me in welcoming Dr. Yadav to the show. I welcome you, sir. It's a pleasure to have you here with us.
Thank you. Thank you very much.
So, sir will guide us through the red flags, risk factors, and routine checks every young adult should be aware of, because when it comes to heart health, prevention is not just better, it's life-saving. So, sir, my first question to you is, we are seeing an alarming rise in heart blockages and heart attacks among people in their 30s. So, what are some of the key factors driving this trend, especially among young Indians?
Yes, you are very correct. A very good question. Like these days, we have seen the minimum age for the heart attacks occurring has gone really down to like mid 30s and the early 30s even. So the main factors which are responsible for this changing scenario is the first important factor would be the lifestyle, the unhealthy lifestyle. I would say that eating of fast foods, processed foods, and sugary beverages, especially among the younger ones, that has given rise to increased incidence of obesity in young, and also dyslipidemia, like rising of the cholesterol levels, and which leads to ultimately diabetes also. And the second important factor in lifestyle comes in sedentary lifestyle. Like there are desk jobs, especially in people with IT industry. They are not able to do exercises daily, and mostly they are sitting on the desk doing the jobs with very prolonged hours, very less time for personal health. That has also given rise to weight gains and poor cardiovascular fitness. And the third important factor which has also increased among the youngsters is the increasing sense of smoking and alcohol consumption, which has very tremendously given rise to increased incidence of heart attacks, especially in young people. Third important factor which comes into play is the disturbed sleep patterns. Due to this chronic stress which has been there in their lifestyle and lack of physical activity, and their sleep cycle has also been disturbed, which gives rise to increased cortisol levels, which again, and the adrenaline levels, which again increase the blood pressure, which is also not good for the heart health, and is giving rise to increasing incidence of cardiovascular diseases among the younger generation.
So that was very briefly and nicely explained. So how are these different, like how these symptoms of a heart attack for a younger individuals are different from the ones that an older patient might experience? Like, are there any early warning signs that people in their 30s should watch out for?
We have seen the difference in the risk factors and the symptoms which are being experienced by the young people. They are almost the same, but the severity is, which we have seen, is more in the younger generation. The symptoms could be chest pain, severe chest pain, which might be radiating to the jaws, to the hand, to the neck or back, which is accompanied by cold sweats. This is the first symptom, which is a kind of red flag for especially young people. Any like anything which is out of the way, fatigability, anxiety, leading to increased heart rate, or dizziness, or cold sweats. This is the second symptom which most of the youngsters are seen experiencing these days. Third important symptom is like loss of consciousness, easy fatigability. Like most of the time, even after having rest, they keep feeling fatigued or like tired all the time. This is also a risk factor that despite rest, the body is still needing, like we are very tired, we have to rest all the time. These are the three important risk factors. The fourth important risk factor is shortness of breath on minimal exercise. This is one of the most important. Last but not the least, shortness of breath in mild exercise or even at rest is a very important symptom.
And like you mentioned about the sedentary lifestyle, diet, and stress. So, sir, is there a genetic angle also involved in heart attacks?
What we have seen is in around 20% of the cases of sudden cardiac arrest, especially in the young people, we have seen that 20% cases are genetically inclined. Like there are cases genetic risk factor. We mean to say that cases of cardiomyopathies, like which remain undiagnosed, like people do not have many symptoms during the early stages of the disease, which remain undiagnosed for a long time. Cases of hypercholesterolemia, like the cholesterol levels keep on high. It's a familial genetic disease, and which leads to early development of coronary artery disease. These are some genetic factors, and genetic predisposition to the diabetes mellitus and hypertension also. If the parents are having these problems, there are chances that their children might also have them. So genetics, it plays an important role, but not the major role, you can say.
So, my next question to you is many people assume regular fitness routines protect them fully. So, can someone who's physically active still be at risk of heart blockages or sudden cardiac events?
See, in Indian scenario, especially in the South Asian countries, South Asian population are itself very predisposed to this coronary vascular diseases. And as I mentioned earlier, that the genetic predisposition are also there. And if somebody is genetically predisposed to this disease, he might not have many symptoms in the early stages. And if he still is exercising, he might be at a risk of sudden cardiac arrest. And the people who are at risk, I already told you, like people who are addicted to smoking and alcohol, sedentary lifestyle, and the eating habits are not uh, good, and the sleep is not good, and they do not exercise daily. These people are at high risk of getting cardiac arrest if they are even if they are exercising.
And how important are routine screenings for heart health in people under 40? Like, at what age should someone with no known risk factors begin with the heart checkups?
Earlier, the age for screening for heart health used to be around 50 and above. But these days, since the incidence of the heart attacks and heart diseases, cardiovascular diseases are increasing in the younger age group, we usually recommend that if someone with no risk factors and no genetic predisposition should get tested above age of 30 years, at least 2 to 3 years, every 3 years, they should get checked for the heart health. The things which they should get checked are like blood pressure, their sugar levels. A stress test could be done, like stress echo or TMT. These are the basic minimal tests which they should get it done, including the lipid profile, the cholesterol levels. Every 3 years, the persons who are not having any risk factors, for them.
And my final question to you. So, on this World Heart Day, what would be your top three lifestyle recommendations for young adults to safeguard their heart health before it's too late?
On this World Heart Day, my advice for the younger generation would be the first one: eat healthy. Eat fruits. You should include fruits, vegetables, and nuts in your diet. Avoid processed foods and sugary beverages. The second would be exercise daily. Keep a routine that for reducing stress and the body health, heart health, you need to exercise daily, any type of exercise. Usually, it is recommended that at least 150 minutes of exercise per week, moderate exercise like a brisk walk or a jog, should be done. The third important thing is quit smoking and alcohol. Smoking is very dangerous. It hardens the arteries, it blocks them, reduces the blood flow to the heart, leading to cardiac arrest. And alcohol, it is the most toxic substance that can be intake by the human body. It is toxic to every cell of the body. So I would say that eat healthy, have a good sleep, exercise daily, and quit smoking and alcohol.
Thank you so much, sir, for your time, for sharing such valuable insights with us. Thank you so much.